Hey, everybody, we're gonna get started. If I can get your attention up to the front. Welcome to the 2024 CU Innovations Award Dinner. My name is Avalon Swenson. I'm a fourth year graduating this year, and I've been heading the Innovations Committee this year. So my pleasure to work with my team, Dr. Ristisi, Margie, and the rest of the team. And we're happy to have you here tonight. So we're excited to have a chance to spend a few hours together, and we hope that you guys will leave with a better understanding of what this award means and the work that is being done by the students that are recipients of this award. We're here to celebrate our current scholars and learn about their successes and challenges over the last year with their own projects. And we're delighted to hear from our upcoming scholars about their projects as well. So thank you to everyone for coming again. Our planning committee, I just want to give a quick shout out to Dr. Ristisi. He's kind of the head of everything. Dr. Frank Reed, Dr. Mark Goncalves, who has joined us this year as part of our team. And then Josiah, Emmanuel, and Jamie, you guys have been fantastic to work with, and I appreciate you to the world's end. So thank you for everything. Same goes for Vanessa and Margie. You guys have been doing the most for us. So thank you for all your hard work. So before we get started with the award, and before I have some faculty come up and speak to you, I'd like to just give a brief overview of what the Innovations Award is. So this award was created as part of an ongoing effort to bridge the gap between our campus and the surrounding community. This award is up to $2,000 for students who plan and carry out philanthropic work with the money that they're awarded in the surrounding Aurora and Denver communities. And our goal ultimately is to provide that seed money for a sustainable project that will directly benefit our community. So the recent addition of CU Medical Alumni Association and the incorporation of the Alumni Mentors for Projects has made a large difference in the success of our teams that we fund every year. We have mentors who volunteer, and they're assigned to groups based on the current applications for that academic year and past experiences of the alumni mentors to kind of synchronize the teams better. And they provide students with learning opportunities on how to write grants that are strong and ideally will get awarded at the end of the time. During the year, we have mentor nights with the mentees and mentors to help them get to know one another and learn from one another. And I wanted to just, again, thank you to the mentors who are here via Zoom or in person tonight. You guys have made a big difference in the work of our students. So without further ado, I'd like to introduce Dr. Mark Goncalves. He's the president-elect of the CU Medical Alumni Association, and he will be giving a little presentation for you all.
Evening, all. Thanks for taking some time out from your busy schedules to help us with this celebration. I am Dr. Mark Goncalves. I am the president-elect of the Medical Alumni Association, and I'm a graduate of CU Med School, class of '82. I'm very happy, as is the Medical Alumni Association, to see how far this initiative has come since its inception. The impact our students have made in the surrounding community and all the connections that have been made between our alumni and by way of these projects. I know many have been involved with this project, so I would like to especially thank the total of the Medical Alumni Association, Board of Directors, and just a side note, the C should have a cedilla. It's like a French C. It's a Portuguese name, so the C is like an S. So it's going to solve this, and that has confused people for all of my life and a lot of my dad's life too. So just to clarify. In 2016, Dr. Rustisi in Alumni Association that he needed help with funding with a project that I think was already ongoing, but barely. And in order to provide incentive, construction of the projects involved a grant-like situation and a sum of money. So he engaged Alumni Association to help support the funding of the projects, which the Alumni Association was. Since then, thanks to generosity of the alumni benefactors, there has been an Innovations in Medical and Education Endowment Fund that has raised over $163,000 support these futuristic projects of the future, not the projects themselves being current. The Medical Alumni Association has a goal for this endowment to reach $250,000 so that it can spin off a minimum of $10,000 a year current allotment for these grants. Alumni out there are interested in helping support this initiative with a donation. You place a link in the chat, or for those that are here in person, there's a QR code on the back of the flyer, or you can reach out to Vanessa Duran, and for those of you who know Dr. Rustisi, you know that he wasn't done with just asking for funding. He asked for mentorship help as well, and so that some of the alumni could help the individual students develop the projects, putting together a budget and submitting grants. A success. Apparently there are more alumni interested in mentoring. My fellow alumni for adding their support. It's really been incredible how involved with this initiative that personally am happy to be a part of it as well. It's part of my involvement in the Medical Alumni Association is fundraising and the activities, cultural activities and so forth. I'm specifically interested in helping the student initiatives. Glad to be here too. Thank you all for joining us tonight, including those that are on Zoom, and forward to hearing from the students with that. I will turn the program.
I'd like to introduce Dr. Rustisi, who is coming up shortly. He has been integral, as Dr. Gonsalves talked about, to this project. It's been an honor to work with and learn from Dr. Rustisi over the last few years to continue to grow the Innovations Award and the relationships that our students build with their mentors. So please join me in welcoming Dr. Rustisi.
Everybody. So I am a class of 2008 graduate. So it was just the other day, not sitting in this campus because it was back in the old days where we had, and then have been a resident here and then a faculty member, and I've been on the school faculty paid position. Currently run our base camp, so I will see many training. And one of the things that I think I can do as an alumni member who's also in the School of Medicine is to try to bridge what the School of Medicine wants you to be and how the alumni can support that. And so we have 3 words that we all recruited many of you to: curiosity, leadership and commitment. And so commitment means like doing something to better the world. And this is our opportunity as alumni members to put money behind that idea, is to say, I want you to be the future. And we can now support you better than we've ever been able to. And our hope is to make this into a legacy where you all at some point are standing in my spot, 20 years. Able to kind of see where this has come and how our school really has made this. So that to say, like, that's what we're bringing to the table from the School of Medicine and the alumni side, but from the student side, you all are doing amazing things, whether presenting or whether you're watching this later. Like, these are the kind of projects that we really love to see, that mean that we're building doctors that we all want, and if happy to have you treat our family. There are multiple ways to donate. We don't expect all of our trainees to be a part of this, but anyone out there who are alumni members, like, thank you if you have already donated. The more we can build this fund, the more great things that we can support. So in addition to funding things, which we gave you the link to, there are other ways that you can also support us. I saw multiple mentors who are in the Zoom room right now, but those people have really helped our students learn to write grants in an effective way, and we hope that that will help them into the future side of this particular. We vote on all the projects, and so the alumni members can weigh in on what projects they want to see prioritized. And then lastly, have this event. And so this is our like showcase to kind of bring this full circle and really see what the students are doing, or at least are trying to make. So thank you all for spending the time being here. Again, the link is in the chat, but you can also use the QR.
Thank you, Dr. Estacey, as always. So without further ado, I'd like to introduce our newest scholars for this year. We'll be hearing from them first with a brief presentation regarding their project. The first person presenting will be Brandon Middlemist. He'll be presenting via Zoom. He's on the rural track and was unable to make it tonight, but his project is called the Adaptive Model for Complex Patients. So without further ado, Brandon, please take it away.
Awesome. Thanks for having me. Hi, everyone. My name is Brandon, second year medical student. And like Avon said, I am a member of the rural program. So I am down here in the San Luis Valley. And my project is the Adaptive Care Initiative. This has been a project that has been in the works for a little while now. It's a collaboration between Children's Hospital and one of the local pediatrics offices here in the Valley. The Children's Specialty Clinic of the San Luis Valley. And this project is meant to be a model of care. If you've experienced, children's, or if you've worked there, you may have seen patients who have had an adaptive care program or an adaptive care plan. And this was a way to bring that resource to rural Colorado. And so this project has lots of different components, from everything from pre-visit surveys to really get to know complex kids and their unique strengths and their challenges in medical appointments, to things like social stories and videos in this resource library for families to utilize to help prepare their kids for doctor's visits, because they can be really challenging. And then really where this award has come into play and has been super helpful is with kind of funding some materials to actually help support patients in visits, with things like weighted lap pads, headphones, fluorescent light covers, all things to help support our kids in these appointments. You can go to the next slide. Yeah, thanks. Some of the challenges that I anticipate having, as with everybody's favorite thing, the EMR integration of the questionnaire and these kind of all the pre-visit paperwork is expected to be kind of a challenge, just knowing how EMRs work and how difficult it can be sometimes to have kind of an accessible way to fill out forms. Another challenge is actually we're starting kind of from scratch with the videos to walk through a clinic visit, and so kind of brainstorming the best way to make these videos both useful and engaging, while also being kind of developmentally appropriate is something that's been taking a lot of thought and a lot of working with kind of the folks at Children's to kind of brainstorm ideas to make that uh, uh, appropriate. And then kind of the last thing is because I'm in such a remote area, being in the San Luis Valley, just raising awareness of this type of program and just spreading the word is, I think, going to be another challenge for families. Kind of the last bit and kind of the reason this project came about is I was born and raised in the San Luis Valley. I'm Colorado native, and so this has been a huge privilege and an honor to be able to kind of bridge the gap as kind of the mission of the Innovations Award between the School of Medicine and the Alumni Association in Denver, all the way down here in the San Luis Valley, and just bringing this resource to such a resource limited area. It's really a privilege. So I just wanted to take a second to thank you all and thank the alumni and my mentor, Dr. Jack, for supporting me in this project.
Thank you, Brandon. Before we move on to the next project, any questions or comments for Brandon? If you do have any, please press the button on the microphone at your workstation.
Hey, Brendan. I imagine you can hear me, but I'm super curious about what experiences brought you to this issue that exists in the San Luis Valley, and yeah, it's pretty cool. So tell me more about that.
That's a great question. So kind of my background, before I even was in medical school, in my gap year, I worked with families I worked in a rehab clinic for kids who had different, motor conditions like cerebral palsy, spina bifida, and hearing their experiences with the healthcare system, and how there's a lot of medical trauma associated with going to the doctor. I wanted to be able to support families and find a way to make going to the doctor a less kind of scary experience. And so kind of finding ways to meet families where they're at, meet patients where they're at, was kind of the brainstorming part of where this project came from. And then as kind of expected, there's like 2 pediatrics offices here in the San Luis Valley. So any way to bring this kind of resource to families here in the Valley so they don't have to travel nearly 3 hours to the closest Children's to get care was a huge goal of mine.
Thanks.
Yeah.
Hi, I have a question for Brandon. I'm Dr. McClellan. I'm one of the board members, and I've worked in rural practice for the last 11 years in Wisconsin and now in Colorado. So I think this is a great project. It's so exciting, and I think it's really needed. Have you thought about any ways that you might be able to make this project sort of endure or be available to other areas in the future?
Yeah, absolutely. And that's a great question. So part of the project is I'm doing kind of pre and post survey data of kind of family experiences with the healthcare system. And then kind of weeding out, what part of this project is going to be well received and where can improvements be made. And then kind of the goal kind of down the line is to essentially bundle this all up into some kind of package, whether that's a training package that I can bring to different clinics. And once it's once it's up and running at the clinic I'm currently working with, it's pretty self-sustained. It doesn't take a lot. It just, it's a pretty small clinic that I'm working at. So it's very flexible in that manner. And so kind of being smart about how to, make sure this is scalable and expandable to other clinics is also definitely part of the project and is one of the outcomes I'm actually looking at.
That's fantastic. Thank you so much.
Good question. Thanks.
Okay, thank you, Brandon. I really appreciate you presenting. I know Zoom is not always ideal, but I appreciate you being here nonetheless. So we will move on to our next project. It is called Wound Support for Facial Trauma, and it was initially sent in and is being run by Sonali Pandiria and then Rebecca Henkind, who are both unable to be here tonight, unfortunately. And so Jamie Cronin, our MS1, will be presenting their slides for them. Thank you, Jamie.
So this team's aim and project is to serve after discharging with massive persons experiencing homelessness are disproportionately affected by several medical conditions, which has led to a 30-year reduction in estimated lifespan. Wound care is particularly concerning altered living conditions. This team has sought to partner with the UCH Housing Transition Team Wound Care Closet in order to provide protein shakes for nourishment, jaw wide cutters in event of an airway emergency. Some of their anticipated challenges are having to actually find objective outcome data for these patients, given the sensitive nature of their lifestyles and HIPAA constraints. But thankfully, the HTT or the Housing Transition Team at UC Health has dealt with similar projects in the past and been able to quantitatively outcome and impact of these projects.
If you do have questions for groups that are not here, please write them down either in the chat or on any piece of paper or your phone in front of you, and we'll kind of make them into a sheet later to give on to groups that are unable to be here. Our next presentation is called Pediatric Healthy Beginnings Free Clinic. And this was sent in and is being completed by Hannah Kylo, Zoe Lee Chiang, and Emma Greenberg. Zoe and Emma are here tonight to present to us.
Hi, everyone. My name is Zoe Lee Chong. I'm a fourth year going in. The Healthy Beginnings Clinic at Warren Village is a nonprofit in Denver that serves unhoused single-parent families. And the CU School of Medicine students have been operating a pediatric clinic at Warren Village for almost. Unfortunately, we had to close the clinic during the. Also, we're facing some restructuring with our faculty leadership, which caused us to really evaluate the impact that we were having in this community. So we did a needs assessment with the community last summer that actually found that child healthcare was not a huge need in this community, that it was adult healthcare services as well as community building. And so with that in mind, we've launched an innovative community-focused health education series for adults and for their children for Warren Village residents. Go to the next slide. The bulk of our focus with these efforts are going to be around an educational, focusing on needs brought up by the community in our needs assessment. We've already had 2 sessions so far this spring that were met with a lot of positive feedback from the community. These sessions, as Zoe mentioned, target both adults and children in the community. Our first session was during kind of viral season and had more concrete medical information provided to the parents, while children received more hands-on fun activities to increase health literacy at their kind of skill level for children. We also had good turnout and feedback from our healthy eating and exercise session in January. And kind of the bulk of our efforts are focused on our next session, which is providing CPR to mainly teenagers in the community who are looking for opportunities to have like more responsibility and to pursue jobs in the community through lifeguarding, through babysitting, and to be able to have safety skills that will set them up for success in the short and long term. So that is kind of the bulk of the efforts from the Innovations Award will be going to for the CPR classes for these young adults. And we will continue to have these sessions throughout the summer and anticipate that we will likely repeat these sessions on a yearly basis. A big part of our efforts are really focused on our community partnerships. We partner both with Warren Village and then with our CPR class, as well as our other efforts. We are kind of expanding our scope to partner as well with the Spring Institute, which provides services to immigrant Denver area. So we will be including individuals from that community in our series going forward as well. And also with the community organization Helmet Heads to provide kind of help with our bike and scooter safety. Some challenges that we anticipate having with this community, especially with Warren Village, is because it is a transitional housing community, just making sure that we continue to address the community needs as the demographics change. So this will be continuing to perform needs assessments and working with both families at the community and leaders to make sure that we are still addressing relevant needs in the community as we move forward with this series and with our clinic in general as we continue to kind of reassess how we can best impact the community. So we are really grateful for the support we've received from the Alumni Association, and we're excited to
Does anybody have any questions for the project?
I have one quick question. Project sounds like a great idea. Part of the projects are supposed to involve sustainability, which you've already addressed to some degree. Who is actually providing the educational sessions in the pilot, in the initial? Are the students, or are you engaging members of the Warren Village, or, and then how do you project that that's gonna play out in the future?
Sessions so far have been taught by CU medical students. I think the 2-decade-long partnership that we've had with this community is really encouraging for kind of longevity for student involvement with the community. We have a really strong relationship with the leadership and the kind of structure of the community, and I think we continue to receive a lot of interest from incoming classes of students. And so I think at this point it will continue to be taught by students, but I think also capacity building to involve people who work at the facility as well to take part in the teaching. We do have volunteers from the community who help at the sessions, but a lot of the medical information is still provided by students. So I think we can continue to build that partnership to make sure that these sessions and the clinic as a whole is sustainable.
Part of the challenge is also we're trying to recruit attendings and residents right now from both the pediatric and the IM side to come help with our.
Wonderful project. And I just thank you for sharing with us tonight. I was really impressed to see that you guys were able to complete a needs assessment rather than just assuming what a community needs. You went and asked them directly. I'd love to hear more about how that needs assessment was completed, and kind of, was it a survey? Who did you evaluate and how long did it take?
We used a survey that was given to all residents in the community in the summer of 2023.
And students created the survey in partnership, again, with community members and faculty, not really faculty, but the staff of the facility, to make sure that the questions would be worded in a way that was approachable for families, and that also kind of addressed the full scope of what we were hoping to understand about the community's needs. And it took we had it available to the community for about a month. And then we had several meetings with the staff of the facility to discuss the results and kind of discuss what would be the best steps moving forward from their perspective, and then kind of went from there in terms of developing the educational series.
Oh, that was this one. Yeah, okay. So now we'll move on to our next project. It's called an SMS alert system to prevent overdoses, and we'll be hearing from Dennis Pales regarding this project.
Forward. Cool. Hey everyone, my name is Dennis. I'm an MS2. I'm at the Denver Health LIC. I'm working on this project with my friend Pranav. He's an MPH student here at the university. He's also working in Dr. Barocas's lab here at the university. And essentially what we're working on is an SMS alert system to prevent overdoses. Move to the next slide. I'm sure you all know we're in the worst overdose crisis in this nation's history, and 2023 was the deadliest year for overdose deaths in Denver's history. At this point, we have at least 591 recorded deaths from overdose, and these overdoses are primarily being driven by a toxic and unpredictable drug supply that's constantly changing. Fentanyl changed the game completely a few years ago when it was introduced. And now it's making its way into all sorts of drugs in the drug supply, and new adulterants are entering the scene like xylazine all the time, which is putting people at risk of overdose death and significant injury. Next slide. So my ultimate vision is a SMS alert system to provide people with information about bad batches of drugs that might be going around. This is modeled off work that's been done in several places around the country and work that I worked on in Ohio. The idea is that it essentially broadens informal networks that people who use drugs have been using for decades to share information. Where via word of mouth, they'll just share information about drugs that they encounter, that it was more potent, that they noticed this side effect, that they noticed that a lot of people overdose from this drug. And it essentially takes that model and expands it and puts it out at scale. And the model that I've worked on is more of a hybrid model where it both communicates in a top-down manner where public health agencies, EMS, have their own data from a top-level public health standpoint of where in a city, community, a bunch of overdoses have happened. And it also incorporates bottom-up information in which people who are part of the alert system can submit reports about drugs that they've tested, drugs that they've encountered that are maybe not what they were expecting, more potent than they're used to, and sort of distributes both of these sets of information out to the community. Next slide. So my plan in this sort of next year is to build out relationships with trusted community partners, which me and Pranav have already kind of started doing with organizations like the Harm Reduction Action Center, Denver Mutual Aid, Urban Peak, the youth shelter downtown. We want to distribute evidence-based harm reduction supplies and drug testing materials like fentanyl test strips and xylazine test strips so that people on an individual level can know what drugs they're taking and whether they have adulterants. And then begin to collect that data about drugs that the people that we've given these materials to have tested and attempt to disseminate that information out to the public. The end vision is to do this via SMS alerts. I think the biggest challenge and limitation that we're sort of facing is a technological one. The technology exists already, but it's sort of at a rudimentary level. A lot of it was built by students around the country. It hasn't really been done in a city at scale, but I think there's other ways to disseminate information that's not necessarily SMS for now. And I think the biggest, while this is our end vision, is one that's distributed via SMS. I think the biggest thing that we can do that we're working on right now is how do we get people to start submitting alerts to us? What are other ways without like a technological burden that we can disseminate this information to people, and then get sort of public buy-in from community organizations and people who use drugs or are at risk of overdose in the community. So yeah, that's the project. Happy to answer any questions that you might have.
A quick question. Good presentation, good idea. I'm curious about buy-in, both by the participants and by the community helpers. I expect from the community helpers, it might be easier than from the participants. And then the second part of that question is, of those people that have chosen to participate, who collects the data? Who collects the information? And is that a logistics challenge? And then what is done with that information?
Yeah. So to answer your first question on buy-in, I imagine that, you know, trusted community partners are always going to be better disseminators of information or asking for buy-in from the public than I'm going to be. And so the idea is that hopefully once we sort of develop these community relationships, that they're the ones that could be disseminating these harm reduction supplies, letting people know, hey, you know, we'll attach a QR code or a link to the back of each test strip where people can submit information that they encounter. And then we are developing a anonymous secure database where people can anonymously, not submitting any personal information, not collecting phone numbers, where they can submit that information anonymously. So we would be using that. We would be basically just collecting the bare minimum information that is needed to be useful to other people, what drug people thought they were looking for, what drug that they maybe tested, what was odd about the drug that they encountered, that sort of thing. And then we would disseminate that to the community. In terms of a more like location-based thing, which is also a significant part of it, we would also not ask for anything super specific, but enough to be helpful. So like something like in Park Hill rather than in, you know, at this intersection. Yeah, does that answer your question? Yeah, it's challenging. I've worked on something similar to this before, and I've found like the data that we have so far is that about 80% of submitted alerts are then associated with a spike in overdoses in that neighborhood in the coming days. So like the model works if once it's like gets big enough that you get enough buy-in. I don't imagine that it'll be that big within the coming year. There's a lot of work to do. But any, you know, piece of information that could save somebody's life, I think is useful at this stage.
Dennis, I really like this project. I'm curious, ultimately, you will leave here, Pranav will leave here. Who will be the owner of this database? Is it one of your community partners? Do you guys have a plan for that? I'm curious what that looks like.
Yeah, our end goal is to ultimately, once we have the technology, the database, is to give it to another community partner that can manage it more effectively in the long term, especially those who already have their ears on the ground that I know will be around for a long time. And honestly, it doesn't take that much to operate, just like screening for when alerts come in and then sending them out.
Have you thought about how you might use social media to kind of amplify your voice instead of just SMS?
Yes, and I think social media is sort of the big outlet that we are hoping to utilize, and then having a lot of our trusted community partners to amplify that too. I think social media is already a great opportunity for people who would want to share alerts. The problem is that social media is obviously not anonymous. So as an entity, we would hope to be that sort of like collecting ground where people can submit anonymously and then we can just send them out. And then people can sort of subscribe to the alerts via social media, which a lot of people, especially young folks who are at risk of unintentional overdose from a recreational substance could be utilizing effectively.
Sorry,
We
one
have
more
a
quick
question online right now. This is from Dr. Douglas Scott. He wants to know, is there any problem in our community with prescription amphetamine overdose?
So I'm not so sure about that. A lot of the driver of overdoses right now is still fentanyl. Whether that be fentanyl overdoses from people who are looking for fentanyl or fentanyl that is encountered unexpectedly in the drug supply. Our project more deals with folks in the latter category. So if people are buying pills, stimulants on the street, we don't know where those pills are coming from. We don't know whether there's other adulterants in them. So I would imagine that if there are people who are overdosing from stimulant pills, that they're ones that are laced with adulterants that they are not getting from a physician. But that's just sort of my understanding of what the data is right now.
Now, is there a way like you can get some testing devices with the test kits that are coded and they can go on a street corner and test themselves or test the drug and then it goes to a central database?
Yeah, so I mean, we have what we're hoping to do is just like individual test strips with opportunities for people to submit alerts like via a link or QR code on the back of each strip. That's sort of on an individual level. On a more public health level, there is a bill, I'm not sure if it's been signed by the governor, but it's probably gonna get through the legislature that's gonna allow drug testing at the syringe exchange here downtown, which I think will be a really wonderful data collection opportunity and dissemination opportunity if that were to go through. In which case people, I believe the site will have a mass spectrometer. So people will have very specific like levels of potency, what substances are in whatever drug that they're using. And then hopefully once that's implemented, we can disseminate that as well. But that's sort of also as part of a public health project that will be sort of city level data collection.
Thank you, Dennis. And our last new scholar project for this year was submitted by Lena Tatt and Rebecca Henkind. And this is also harm reduction supplies for homeless patients. And Lena is here to give us her presentation.
All right, good evening, everyone. My name is Lena Tatt. I am a current MS2 student, also part of the Denver Health LIC track right now. So a little bit background about CU Street Medicine, and I'm not sure how many people are familiar with it, but it was founded by Dr. Boitro, Dr. Harpin, Rebecca Hankind, who's in MS4, and Kiara Connelly, who is a RN student in 2021. So a lot of the work we do is we partner with the Young We Clinic and we provide medical service to people who are experiencing homelessness or who are having housing insecure. So the initiative of this project is how do we create meaningful and real change to this population? And on the student side, how do we provide students with opportunity to learn about social justice and trauma-informed care? So in previous year, we have been very lucky to be funded by the Innovation Award, which helped us obtain many like wound care supplies. We established a closet at the Community Crisis Center and enabled the group to provide food care clinic at the local shelter and outreach. So what has been done so far is, you might have heard this earlier too, unhoused population have been shown to have a 30-year reduction in life expectancy compared to the general public population. They're more likely to suffer substance use disorder, particularly infectious disease due to location of like living in close proximity with other and shelter on the street, and they have worse outcome in terms of due to malnutrition, high rate of HIV, transmitted disease, and poor access to healthcare. So previous study have shown that opioid education and naloxone intervention have significantly decreased overdose and transmission of infectious disease up to 8.3%. I won't labor the fact about that we're in overdose crisis because Dennis just gave a beautiful talk about that. So our goal is really to expand upon, the harm reduction that we're already doing in unhoused population, and how do we empower this individual to have safer and more self-directed life. So currently, CUSM have outreach. We have routine and pop-up clinic in Commerce cities, in Aurora, and also in Thornton. So we already have established partnerships. Last year, we were able to collaborate with the Colorado Naloxone Project when we obtained an assembled naloxone kit. And we performed an assessment of need during our outreach to ask what kind of need do these populations see that they still need in our future outreach. And fentanyl strip and along with other harm reduction popped up as our #1 demand. So our next step, with the help of the funding, is to obtain additional kit that we can assemble and hand out during our outreach. Mostly will be distributed by our own volunteers, which comprise of medical student, PA, PT, nursing student, kind of everyone on the CU Anschutz campus. We also, while we distribute those kits, want to provide education on overdose, safe hygiene, and promote community resources that are already available that some of these individuals might not aware of. Our goal is to also conduct an IRB-approved survey, not to assess how much our intervention help address their need, but also to further assess if there's anything else that we can provide for these community. We hope to also able to conduct some in-depth interview with these individual users if they feel comfortable sharing with us. So some of the anticipated challenge would be, first is consistency, because a lot of our distribution and promotion is through outreach. So we always welcome new volunteers who want to come with us. We welcome providers, student, individual of any kind of background, and we help you to provide you the adequate training so you feel safe and comfortable when you're on the street with us. And another one is just to how to create, a survey that is like easy, quick access that we can do quick point of touch during our outreaches. And right now we're leaning towards doing physical copy, but we do want to expand into digital form. But we do want to keep in mind the limitation, like not everybody in this population have a house, have access to Wi-Fi to conduct the QR code. So providing more model of how we can assess people need is one thing that we also want to work about too. And I just want to say thank you to the Innovation Award Committee for all the donation that we have that have been supporting CU Street Med, and I hope I can answer any question that you all have.
We do have a question online from Dr. Scott. How do you use a fentanyl test strip?
Yeah, so we were struggling between that because our goal is more to promote distributing those equipment. In terms of training, we're hoping that we're able to get like a professional healthcare who can able to guide, teach our volunteer member on how to use it. Unfortunately, I do not know how to use it, but the plan is to set up a training so that, the volunteer are able to answer that question. But one thing we also want to stray away from is we don't want to create like any kind of stigma. We want to welcome that anyone who come up to us and get these resources, they feel comfortable walking away with it. They don't have to use it on themselves. They can use it on other people, kind of working on these stigmatized and fear that they might be punished if they like come grab resources from us too.
Hey, hello. I don't know if I'm on. Oh. So great idea and big fan of CU Street Medicine. You guys have been working at this project for a lot, with this population for a while. Have you come up with any like survey techniques from your past work that you could reapply, and what might that look like?
So I would say we're a relative new organization, and in terms of past techniques that we have tried, it's kind of along the line of things that I already mentioned, having like physical form of survey. One thing we found is a lot of individuals tend to show up to the same location, especially in our partnership. So we also provide survey, just leaving them at the site, so that not necessarily everybody has to do it during our pop-up. They can also just come back at a later time and pick it up too. We also have a old but useful computer system where everything is anonymous. So let's say while they waiting for their friend or when they have question about any of the resource we're giving them, they can also like sign up on during the computer, and we're happy to, if they feel comfortable leaving out their information, we're also happy to reach out and address like any further question they might have too.
Great, thank you.
I have a question for you, and I apologize if I missed this, but you had mentioned that you are working with nursing PT, PA students. How are you going about recruiting them? How many? Is it a requirement, or how many are involved, and then what exactly are they helping with again?
So we have a new system this year. So in order to kind of coordinate how our team is running, we started selecting a liaison for each of the school. So the liaison job is to promote to different program in terms of, doing like orientation, kind of promoting. And we also hang poster throughout the campus. Their job is to kind of promote our event through the volunteer, and volunteer can choose different things they do. They can show up at our pop-up clinic where they work with the provider. They not necessarily is equipped to provide the direct care for liability reason, but learning how to provide care to a very sensitive population. And we have shift where we do backpack, where we have resources and kind of handing out those resources while we're doing street outing. Or they can also help with our food center, where they just kind of distribute the food and the pantry to whoever show up.
Thank you.
Yeah. All right. Thank you.
Thank you, Lena. Now we will move on to our current scholars. So these are folks who were awarded in the 2023-2024 cycle and have been working on their project over the last year or so, and are here to talk about how that project is going, any challenges that they faced, anything that they've learned. So our first group is going to be increasing awareness of substance use disorder treatment resources. This will be presented by Caitlin Blades and Jennifer Felker. Martin Maxwell is also a part of their group.
Good evening, everyone, and thank you for attending tonight. We had lovely introduction. Thank you very much. So our project ending this year, but will be carried on by future med students, is titled Increasing Awareness of Resources for Substance Use Disorder Treatment in Larimer County, which is Northern Colorado. And our team includes Jen, myself, Caitlin Blades, as well as Martin Maxwell, who is unfortunately not able to attend tonight. Next slide. And so to begin, we'd like to offer some background on defining the problem that we were trying to address. And so substance use disorders pose an exceptional challenge to individual and community health, as well as healthcare resources. And medication-assisted treatment, which will be referred to as MAT throughout this presentation, is the safest single method of treating opioid use disorders. And this treatment involves medications such as methadone, buprenorphine, and naltrexone. And MAT is offered by Summit Stone Health Partners, which is a service that is offered for little or no cost to Larimer County residents. And that's why we wanted to target this population, because it had such a great opportunity to receive care. However, Summit Stone MAT clinics are vastly underutilized, and patients with these disorders and struggling and needing help are vastly underserved. So the goal of our project was to bridge the gap between life-saving community resources and a community that was in need of them.
So we had very different community outreach and goals with this funding. The first one that we targeted was to present at the annual Northern Colorado Medical Society meeting. Our goal with this was to dispel common myths that physicians may have about MAT services and provide referral information regarding those services. We found that a lot of physicians are hesitant to refer their patients to these services because they fear overdose and other myths that are really common with MAT services. So we wanted to take the opportunity to speak to the physicians of Northern Colorado to help dispel those and promote Summit Stone as a resource in the community. We also hosted a MAT clinic table at the Northern Colorado Medical Society summer event to just help increase our reach among those And at that event, we were able to give out merchandise that had Summit Stone Health information on it, and further contact information for referrals that they could then put into their clinics. And we also hosted a MAT clinic booth at the first annual Fight the Stigma event in Northern Colorado, which was a really awesome event that was put on this year, organized by a physician who specializes in addiction medicine. And it really just rallied the community to talk about mental health issues and substance use disorders. And at that event, we were able to distribute resources such as Narcan, fentanyl test strips, and just more information about the MAT services that are available in Northern Colorado. And that really allowed us to reach the community members in attendance. And we were also able to distribute the QR codes that you see there, which are like how to use Narcan, why you shouldn't use alone, and then instructions for the fentanyl testing strips as well. And then we were tracking some data about the before and after of these events and if the referrals increased. Since our first event in March of last year, there were almost 1,300 referrals. It's a little hard to compare to before because Summit Stone actually switched their admin like tracking in between, and they also opened a new hospital. So a little bit hard to get a direct comparison, but overall, we're really pleased with the number of referrals that they received. And for us, the most important thing is that the increase in these patient referrals means that there's increased use in these MAT resources, and more individuals experiencing these substance use disorders were able to find the treatment that they needed. So we just want to thank the committee for providing us with the funding in order to be at these events and help spread the word about substance use disorder and MAT services in Northern Colorado. And as Caitlin said, we've passed this project on to the second years at the Fort Collins branch campus, and they're continuing to work with this community resource to help get more access to it. Take any questions.
I guess I'm wondering, and I might have missed this, but you had mentioned that it was hard to compare numbers to previous data on attendees for these kind of things because there was some admin issues with Summit Stone. And I guess I'm curious if you, how do you know that this is an increase in referrals?
Yeah, so we don't. We kind of from word of mouth, we're inferring that from the sites that we spoke with. But I think it was a little bit kind of a bummer that we weren't able to track data all the way through just because of their systems changing. And they also opened Longview, which is a brand new mental health hospital in Northern Colorado that we're really excited about. And so a lot of attention went towards that and away from their existing clinics during that time.
I know you don't have the data here, but do you think that there's still a gap between the amount of capacity you have to see student or patients and how many patients need it?
Yeah, I would say that there probably still is a gap of the amount of patients that could be taking a hold of this opportunity and really getting the treatment that they need. And so one thing that we thought is since all of these new facilities are opening, which means more opportunity for treatment, we could expand our QR codes and our presence through helping, the rising medical students learn how to go out in the community, learn how to do fentanyl test strips, and when you're giving out these things, how to explain them to the community partners, which oftentimes we found were people who have family members who are suffering from substance use disorder, and it really gets personal and they want to share their story, and they usually take all of that information and then give it to their loved ones. So that was like our biggest hitter, we thought, for referrals. So we want to continue to target that population, but we also had some future ideas to implement in homeless shelters and other places where high traffic areas where people may more likely see them, such as in bathrooms of high traffic areas. And so QR codes are really, accessible. Everyone usually has a mobile device nowadays that they can just quickly scan if they're interested. And so we hope that implementing a few of those additional strategies can help to really target this population in need.
We know people that have mobile devices?
Do we have mobile devices?
No.
Can you repeat that? Okay, yeah.
Now,
Can you
what
repeat-
percentage of homeless people have mobile devices where they could get QR codes?
I was told this before and I do not remember the number, but it is high. It is high, and it's actually very surprising that you go without a lot of things, but they do have access to mobile devices more often than not.
Thank you.
Hi, I have a question. Really great project. Did you track or do you have plans to track any other outcomes besides the number of referrals, like the number of prescriptions, or anything else?
So that's a great idea. We did not initially think of tracking that just because we thought we might run into some issues with HIPAA, with it being a community organization that has their own EMR. But that would be a great thing to try to implement into the future with the second-year students who are taking over this project, to see if there are other ways that we can track our impact in the community.
Thank you, Caitlin and Jen. We will move on to our next project. So encouraging literacy and growth. This has been, it's being worked on by Kaylin Langer, Aditya Mantha, and Gabrielle Helton, and Scott Lynn. None of them are able to be here tonight. And so Emmanuel from the Innovations Committee is coming down to present the slides.
Thanks, Ava. Hey, everybody. So yeah, I have the distinguished opportunity to present encouraging literacy and growth from these fine individuals here. So this all started actually with this group. They all knew each other and they did the community service project actually. That's part of the curriculum here. And they were working with reading partners at Paris Elementary School. And they said, hey, like this is a program that could really grow further and continue to help the community. So their main goal is essentially two things. One, to increase the quantity of books that are representative of the population here in Denver and in Aurora, so particularly Black, Indigenous, people of color, as well as the Latino community, and also to help children meet their reading goals, because studies show that if kids meet their reading goals in elementary school, they go on to do really cool things. Next slide, please. So they partnered with reading partners, and these were their two goals that I might have outlined. So specialize in one-on-one tutoring, and then two, because this population is so diverse, making sure it's equitable in both Spanish and English. And they want to measure it by seeing how well these children meet their reading goals. Next slide. So things that they've been working on and were planning to do last year when they got this award is, one, build out this library of like health sciences books, like Doctor Like Mommy type books. So things that are like, hey, medicine is something that you can go into, and these people are similar to you. And as well as, being on the ground and working with these kids so that they can learn and, be engaged in school. So with this After the Bell campaign, a thing that they've been working on is providing more than just books to children. So including backpacks, writing activities, and ways to stay entertained over the summer more than Fortnite. So a big thing that they accomplished recently was donating a very large number of books to this program. And my favorite part is just like reading these titles and really understanding like the kind of books that they're trying to circulate in the community. Cultivado in Harlem, solid read. And so you could tell it's just like, they're very empowering. And they also introduce this population into things like cardiology, dermatology. I want to be a doctor, which is, it could be a huge foundation of this community going into medicine and treating people that are in this community. So as mentioned, they donated a large number of books. And they said that I was talking to Aditya today, and he said that they want to get good measurements of the data, and they got some preliminary data back that shows that all of the majority of children in their program are either at or above their reading expectations, which I'll confirm with him later, but I believe it was not that when they began the year. So so the program's been successful, and fortunate to be able to present on their behalf.
Thank you, Emmanuel. And again, if you have questions for this project and the next, both of whose team members were unable to be here tonight, please put them in the chat, write them down, and we'll collect them later. So the last project that we have for today of our current scholars is the Iraqi Migrant Health Project. This was led by Laveen Nasha, and she is a fourth-year medical student with me. She was unable to be here tonight, as were her teammates. And so Josiah, another Innovations Committee member, will be coming down to present for her.
Good evening, and thank you to everyone here and online for being here tonight. This is a very exciting event. So I'm presenting on behalf of this wonderful team, the Iraqi Migrant Health Project. My understanding is that this project kind of came about because of the individuals on this team who come from diverse backgrounds, who had some level of involvement and engagement with this community in the Denver Aurora area already. And they started in talking with other community leaders, recognized that, hey, there's some unmet needs here. And maybe that's something we could be a part of addressing. So move on to the next slide, please. Thank you. So these were their three primary goals and objectives from the outset. The first one being to deepen their own understanding of Iraqi migrant health and healthcare needs, experiences, and disparities in Colorado through qualitative and quantitative research. Next, they hope to take their own learning and disseminate those findings to diverse Iraqi migrant stakeholders. And by that, they meant members of the community, but also providers, future medical providers, people who work in public health, social workers, policymakers, really all of these stakeholders who play a part in shaping what resources are available to meet some of these needs. And third is taking that data, disseminating it, and then transforming that into action with partnerships with those very stakeholders, the nonprofit workers, the social workers, and people who work in clinical spaces and as well as in policy spheres. Next slide. So this slide outlines what's been done. As they moved into this project, they looked around and realized there's not a lot of data that's been gathered on Iraqi migrant health, especially in Colorado. So they started out, they partnered with an organization called Aza Adult Daycare, which is a Medicaid-funded center serving over 100 migrants in the Aurora area. And that's kind of where they got their start, started gathering data. And then since then, their latest study objective, as you can read up there, was to assess and understand the mental health needs, perspectives, and experiences of Iraqi migrants in Aurora. So hitting that goal number one. They presented that at the Colorado Area Health Education Conference last fall, and were able to educate state leaders who were present there. So as they continue to engage with different community leaders and center managers, and people just involved in providing resources to this migrant community. A couple of key needs that they kept coming across were one big barrier is lack of medication adherence among members of this community. They also noticed that there's a large unmet mental health need that stems, they believe, from a lot of social isolation and lack of community networking. So what's to come? One of their big goals is a community building event with kind of a dual goal of presenting education to attendees about medical care, medication adherence, and also to try to spur some community networking to spur a little bit more connectedness and opportunities for social engagement within that community, and to help connect people to social or mental health care needs, physical health care needs. So that's what's been done. That's what's to come. Really cool project. If you have any questions, please send them our way.
I have to say, I'm lucky enough to be friends with those folks and was there when they came up with that idea in the library during a study session. So it's been fun to watch that project blossom. I want to say another thank you to everybody here tonight. You've all made this award a possibility for us and for our students, and allow us to continue to support these amazing scholars. We want to issue a special thanks as well to the scholars themselves who not only do the work, but took the time to come tonight to make these presentations for you all and to share their impressive accomplishments with the group and our community. We are honored to be a part of your accomplishments, and we look forward to continuing to support you all moving forward. For some closing remarks as well, if you want more information on these projects, whether or not the folks were not here tonight or you have questions later, links to these presentations will be available. And as Josiah mentioned, you are able to reach out to the Innovations Committee with any questions you may have, either to Dr. Ristisi or to myself as well. My email will also be provided. It's Avalon Swenson. Other than that, it's time to wrap up. So once again, I'd like to call Dr. Gonsalves up to say a few closing remarks.
Before we entirely wrap up for the night, I'd like Ava to step up to the podium for a second. In token of appreciation from the Alumni Association Board, we would like to present you with appreciation for all you've done, work and time spent with this Innovations Committee. Thank you so much. I hope that your next step will benefit from your conscientiousness and your hard work. So good luck in the next few years, and we'll be thinking of you. Let's one more time just give all of these students who have put all of this work into these wonderful projects a hand. As I said, I invested, as are many of the alumni, and clearly the students are. So thanks once again to all of you who participated in these projects. One bureaucratic point, I referenced a QR code on a flyer. Where are the flyers? I didn't see the flyers.
That is a great question. I think what we meant, we will send a QR code and link out after this event with that information.
All right, any wrap-ups, any questions I can answer for anybody? Thank you all for attending, again, including those who had to attend through Zoom. And we will call it an evening until next year's session. Thanks again.